Greetings everyone, this is Dr. Abhishek Samdesi and today we'll be discussing regarding ABG Part 9, which is Interpretation of Acid-Base Balance. In this, we shall discuss regarding the simple disorders and mixed abnormalities. Let us begin. The first thing that we will discuss regarding is the determination of acidosis or alkalosis. So the normal pH range is 7.35 to 7.45, whereas the base normal pH value is 7.40. Then we have the acidosis. In acidosis, we have two types. Either it can be compensated acidosis when the pH is between 7.35 to 7.40, or it can be uncompensated acidosis when the pH is less than 7.35. Similarly, we have alkalosis. In alkalosis, we call it compensated alkalosis when the pH is within the range of 7.40 to 7.45. We call it uncompensated alkalosis when the pH is more than 7.45. So this is the determination whether it is acidosis or alkalosis. Next, we will discuss regarding the two aspects. Is it metabolic or respiratory component? So let us discuss regarding the metabolic component. It is called metabolic component when bicarbonate is the determining factor. So we call it as metabolic acidosis when the bicarbonate levels are less than 22 milliequivalents per liter, and we will call it as alkalosis when the bicarbonate level exceeds 26 milliequivalents per liter. Whenever we tell that the bicarbonate is the determining factor, it is basically mediated through the kidneys, and the compensation of metabolic component is done by carbon dioxide. In metabolic component, we observe the same direction rule between pH and bicarbonate. This I have discussed extensively in the previous videos. Link is given below. Now let us brush up through the concepts and interpretation of metabolic acidosis, which I had discussed in the previous video. The compensation of metabolic acidosis is given by the following formula, which is PaCO2 is equal to bicarbonate plus 15. We have previously discussed regarding the interpretation of a simple acid-base metabolic acidosis. This is the following table. We call it as a simple metabolic acidosis when the carbon dioxide is within the normal range. Now, we always have to apply this formula of PaCO2 is equal to bicarbonate plus 15 if the calculated PaCO2 is matching the determined PaCO2. It is a simple metabolic acidosis. If at all the PaCO2 which is measured is not equal to or matching the decline in carbon dioxide, it means there exists a mixed disorder. So this is the importance of you calculating the expected compensation for all acid-base imbalance. If at all it is not matching, it means that it is a mixed disorder. So in this scenario, say the PaCO2 was not equal to what was expected in the ABG, it means that there exists a respiratory alkalosis also. So this would become a metabolic acidosis with a respiratory alkalosis. The same way with the metabolic alkalosis. As discussed previously, in metabolic alkalosis, the expected compensation is given by the formula of elevated carbon dioxide is equal to 0.75 into the elevation of bicarbonate. And this is the table that we had discussed previously. And note that in metabolic component, all the arrows are in the same direction. It is called a simple metabolic alkalosis when only bicarbonate is elevated and the carbon dioxide is normal. Now, whenever you have both carbon dioxide and bicarbonate elevated, it can be either a simple or a mixed disorder. That is where you apply this formula of expected compensation. After applying the expected compensation formula, if the carbon dioxide matches the carbon dioxide which is elevated, it is still a simple disorder. In case the carbon dioxide that is determined through the formula is not matching the carbon dioxide that is elevated here, it means that there exists a mixed disorder. So in this scenario, suppose the expected compensation is not matching the predicted carbon dioxide, it means that it is a case of metabolic alkalosis with respiratory acidosis. So this is regarding the metabolic component. Now let us move on to the respiratory component, where carbon dioxide is the determinant factor. It is called respiratory acidosis when the carbon dioxide is more than 45, and it is called as respiratory alkalosis when the carbon dioxide is less than 35 mmHg. The respiratory disorder is always compensated by your bicarbonate through kidneys. Unlike the metabolic component, in respiratory component you have the opposite direction rule between the pH and the carbon dioxide. If pH is elevated, carbon dioxide will be decreased. If carbon dioxide is increased, pH will be reduced. This is suggestive of a respiratory component. In respiratory component, you will have acute compensation and chronic compensation. The acute compensation is given by the formula of the elevated bicarbonate should be equal to 0.1 into the elevated carbon dioxide. Whereas for a chronic expected compensation, it is given by the formula of elevated bicarbonate equal to 0.4 into elevated carbon dioxide. So we have already discussed this table in respiratory acidosis video. So again, when we have such a disorder, our task is to identify whether it is a simple disorder or a mixed acid-base imbalance. When we have an isolated elevation of carbon dioxide with normal bicarbonate, this is suggestive of a respiratory component, and it is a simple respiratory acidosis. We will have to think about either a simple or a mixed disorder when even bicarbonate is elevated. As mentioned prior, if the expected compensation formula matches with this, it is either acute or chronic compensation. And the bicarbonate value, if it is not matching either acute or chronic expected compensation formula, it means that there exists respiratory acidosis with metabolic alkalosis. So this is the importance of you applying the expected compensation for every ABG in case even both the variables are either elevated or decreased. Similarly, with respiratory alkalosis, you have the acute compensation and chronic compensation. Acute compensation was given with a formula of predicted bicarbonate is equal to 0.2 into PaCO2, whereas chronic respiratory alkalosis is given by a formula of the decline in bicarbonate is equal to 0.4 into the decline of carbon dioxide. Similarly, as we have discussed in the previous video of respiratory alkalosis, it will be called a simple acid-base balance if there is isolated reduction in carbon dioxide with increase in the pH. You can note that the arrows are in opposite direction. So this is a respiratory component, and because PCO2 is less than 35 mmHg, it is respiratory alkalosis. And isolated reduction in carbon dioxide with normal bicarbonate, it is still a simple acid-base imbalance. It is a straightforward case of respiratory alkalosis. The moment you have even the bicarbonate decreased, the next task is for you to apply the expected compensation ka formula. And if the predicted bicarbonate is matching the bicarbonate which is determined through the ABG, it means it is a simple respiratory alkalosis, either partially compensated or fully compensated. If at all the predicted bicarbonate value is not matching the bicarbonate which is determined in your ABG, it means there exists an additional metabolic imbalance such as respiratory alkalosis with metabolic acidosis because bicarbonate is low. Patient can have multiple conditions resulting in a mixed abnormality. So it is very essential for you to apply the expected compensation formula for all ABGs when both the carbon dioxide and bicarbonate values are not within its normal limits. Now let us have a look at when we call the condition as mixed disorders. We call it the mixed disorder when the PCO2 and bicarbonate are in opposite direction. For example, when carbon dioxide is less and bicarbonate is high. This is suggestive of respiratory alkalosis and the metabolic alkalosis. Similarly, when we have elevated PCO2 and decreased bicarbonate, we can note that it is in the opposite direction. It is again a mixed abnormality. In this scenario, it is respiratory acidosis with metabolic acidosis. So whenever you have the carbon dioxide and bicarbonate in opposite direction, it can be a mixed abnormality. The other scenario where you can expect mixed abnormality to coexist is when the expected compensation is not attained, which I have discussed in detail previously. The third criteria where you can have a mixed disorder is when your delta anion gap is elevated. That would be suggestive of both metabolic alkalosis to exist with metabolic acidosis. This I have explained in detail in the previous video. Now let us have a look with few of these examples. In the first scenario, we see that the pH is on the lower side. So this is suggestive of acidosis. But what we know is the arrows are in opposite direction. So this is definitely having a mixed disorder. Because the bicarbonate is on the lower side and carbon dioxide is also elevated, this is suggestive of metabolic acidosis with respiratory acidosis. Let us have a look with the second scenario. Here, the pH is on a higher level. It is more than 7.40. So it is alkalosis. But what we note here is again, the arrows are in opposite direction. The bicarbonate is elevated and the carbon dioxide is reduced. This is suggestive of a metabolic alkalosis with respiratory alkalosis. Let us have a look at the third scenario. You have a pH within the normal range. You have the bicarbonate elevated and the carbon dioxide elevated. So there is definitely some acid-base imbalance going on. Now your task is to determine whether it is a metabolic component or respiratory component. If all the arrows are in the same direction, say the pH is between 7.40 to 7.45, so the arrow is upward direction. So it all becomes a metabolic component. Apply the expected compensation formula for metabolic alkalosis. If at all it is not matching, it means that the patient has metabolic alkalosis with respiratory acidosis. Similarly, in other scenario, if the pH is normal, bicarbonate is on the lower side and the carbon dioxide is also on the lower side, apply the expected compensation formula. If all arrows are in the same direction, check for the metabolic component. If arrows are in opposite direction of pH and carbon dioxide, it means it is a respiratory component. Apply the formula of expected compensation for respiratory component. In case the predicted value is not matching the determined values here, it means there exists a mixed disorder. So in this scenario, it will be metabolic acidosis with respiratory alkalosis. Now sometimes what happens is this scenario where the pH is normal, the bicarbonate is normal, the carbon dioxide is normal. There are a lot of ABGs where the values are within the normal range. But what you should not miss is calculate the anion gap. If the anion gap is elevated, check for the delta anion gap. Regarding this anion gap and delta anion gap, I have explained in detail in the part 3 of ABG Simplified. So the moment your anion gap is elevated and delta anion gap is more than 1, it means that there exists metabolic acidosis with alkalosis. So do not forget to check the anion gap acidosis even if all the variables are within the normal range. And one thing you should always remember is respiratory acidosis and respiratory alkalosis never coexist together. This table is a simplified version of determination of your mixed disorders. With this video, we conclude the interpretation of the acid-base imbalance. These are my references. In our next video, we shall discuss regarding the last part of ABG Simplified, which is determination of the type of respiratory failure as well as the oxygenation status of patient with given ABG. Thank you for watching.